Okay. Here we are back at DHS addressing female hormones. And as I said before, I'm either going to get this lecture right or I'm going to go out of here in a body bag with the female patients. DHS, my next lecture will be How Your Job is Killing You. Watch for that, March 2nd of next year. Dr. Tent's next lecture, Where Have We Been? Listen, folks, you've seen the Ultimate Malai lecture. You've seen the Energy lecture. Buckle up, pop your popcorn. This lecture is going to rock your foundation and take you on a roller coaster ride you are not soon to forget. You do not want to miss this one on December 1st. Jeff's lecture, Putting It All Together. He's going to be doing that lecture February 2nd of next year. Look for that. It'll be a great lecture. A platform announcement. We now are using DoxyMe. It's easier for the patients. It's easier for the office. This is how we do our virtual appointments at the office. Follow us or like us on Facebook. Subscribe to us on YouTube. Watch our protocols on YouTube, Facebook, and follow us on Rumble. The autoimmune lecture has been scrubbed from YouTube and now can be found on Rumble. Also, the Where Are We Now lecture can also be found on Rumble. So go to Rumble to find those two lectures that have been scrubbed. Connect with us. Find us on Instagram, YouTube, Facebook, and I think now we're on some other sites besides Rumble. Tell us your story. When you're in the office, if you have a success story, tell the story. Let's put it on camera. Let's get it out there. It helps people around the world to learn what we can do at DHS. Give them a different perspective of how we do things. Do things make sense lately? I don't know. I was reading an article and I found this, the pandemic-ready skyscraper. 310 luxury residences, 219 hotel rooms, 10 floors of medical facilities featuring bacteria-killing robots, touchless technology, and a modern air purification system. I don't know. Sounds to me like we're getting ready for something, maybe another pandemic. Does this make sense to you? Periods are sexist. So I looked it up. What's the definition of sexist? Characterized by or showing prejudice, stereotyping, or discrimination, typically against women on the basis of sex. I don't understand that. A period is a wonderful thing. It's the ability to have an offspring. And now we're calling it sexist. The person that paid for that billboard was born because of a period. I don't understand why we would call a period sexist. It just doesn't make sense to me. The only thing that does make sense is in today's world, we cannot afford to get sick. Look at this. Physicians, patients lost their trust in the healthcare system amid the pandemic. Physicians' trust in the U.S. healthcare system significantly declined during the pandemic. The public has more faith in the hospitals than the physicians do. You cannot afford to get sick in today's world. The physicians don't even trust their own system. An extensive study in the United States found that the most productive age in human life is between 60 and 70 years of age. The second most productive stage of human being is from 70 to 80 years of age. The third most productive stage is from 50 to 60 years of age. The average Nobel Prize winner is 62. The average president of a prominent company is 63. The average age of a pastor of 100 largest churches in the United States is 71. The average age of the Pope is 76. This tells us in a way that has been determined that the best years of our life are 60 to 80. Look around. Is this playing out correctly? Are people really in the best years of their life at 60 and 80? I'm not sure. We're seeing a lot of sick people these days. Now, this is my family here. Oldest brother Rodney, Sandy, Neil, Brian, Terry, Karen, Craig, my dad there. As you looked at past lectures, you know my dad passed away at 42 years of life in 1973. Here's my mom. She took over from there. All these rascals were still at home. And here's the thing. No insurance. We had no insurance. We had a chiropractor that was friends with my dad. We had to rely on him. Good guy. He took us in. He said, Bernice, don't worry about it. If you can't pay today, pay tomorrow. If you can't pay tomorrow, pay next week. We always paid him up. But this is how we got to our health care. Our health care was from him. Thank God we didn't have insurance, because most of the people I see in here with insurance are the sickest patients in the office. With no insurance, we relied on alternative medicine. We relied on nutrition. And I remember the days in my basement where these 5 guys, Jim Russell, Jack Lamont, Jerry Lamont, Bob Atwell, and Jack Rosecran, down the basement telling my mom, listen, Bernice, you're wasting your money on that snake oil. You're wasting your money on that nutrition. You're going to that alternative guru guy that I think's a quack. I don't think you should waste your money like that. You have these kids to raise. Well, all 5 of those guys are dead. Most of them were younger than my mom, and some of them were 20 years ago. Let's step over here. Look at my mother here. If you were to crop this picture, cut it, paste it over here, from 38 years old to 91 at her birthday party, I think she looks pretty good. Maybe I would take more of those pills. That's why we say around DSH or DHS, take your pills. Remember, take your pills. Look at my mother at 91 next to my 2 daughters. My oldest daughter, Shelby, the next oldest, Alexis. Look at the complexion in their faces. Look at the color in their faces. Look at how healthy at 90. Most people at 91 are slobbering on their chin. I think it's a good idea to take the pills. Here's more of my kids. Look at them. They're not sissies. We say, Dr. Tent says the girls today are the warriors. Look at my daughter holding the AR-15. She's confident, even has her finger off the trigger properly like you should. This is them, healthy. You don't see the acne on the face. You don't see any weight. You see them healthy, having a good time. When you have healthy kids that take nutrition, you have kids that study on their own. You don't have to ask them to study. They're upstairs studying. They don't get in trouble. You're not spending money on the juvie homes or anything like that. They're wonderful kids. If you do the nutrition, I used to put iodine flaxseed in their bottles. I used to put the powdered nutrients that we had in their bottle, and this is what you get. It's been effortless to raise my kids with nutrition. Let's hear the story of somebody that had a success story with some of the nutrition we use.
I've often said, if you can fix hormones, you'll be a home run with a lot of women. They're very difficult, very hard. You can get yourself in trouble if you don't know what you're doing. But if you get it right, this is the results that you'll get. Tell them about the hormones, what we did.
Well, I was taking bioidentical hormones from a medical nurse practitioner, and my estrogen level got really high, and I gained a ton of weight, and then my thyroid kind of crashed, and I was just overweight, couldn't sleep, crying all the time, and in a fog, like really, but you don't know it because you slide into it slowly. And then so as you start to feel better, it's like you're waking up and you're seeing things differently completely. And you're like, you can't even believe it. It's like a bad dream that you're waking up from. So it's just, you have no stamina, you cry all the time, everybody's trying to hurt you, you get angry, you're frustrated because you pound your body trying to stay physical, like I have done for tennis all my adult life, and your performance isn't there. And you give everything you have physically, but yet the toolbox is empty when your hormones and thyroid are a mess. And this guy seems to know what he's talking about more than anybody I've ever known. And I'm grateful because he's helped me tremendously. And I can't wait to tell as many of the women people that I know who are suffering terribly from this.
So let's see what we can do for your hormones next.
So moving on, is estrogen good or bad? We seem to be quite confused about estrogen these days. So let's look at it. Is estrogen good or bad? Should you take it or avoid it? Everybody seems to be nervous about that word. The answer depends in part by the type of estrogen. Estrogen is the main female hormone causing breast development, monthly menstrual cycles, and the shape of a woman's body, and much more. The estrogen in our body is in a certain percentage. We got 80% estriol, 10% estradiol, and 10% estrone. That's natural to the body. What does estrogen do? It prepares the milk ducts for the milk letdown reflex. Oxytocin from the pituitary sends the milk letdown reflex and prepares the milk for the offspring that's soon to come. Thickens the endometrium. The endometrium is the lining of the uterus. That's where implantation occurs between the sperm and the egg when they come together, and then it grows in there. Prepares the egg for ovulation. Prior to that, it prepares it in the ovary for release. And then it thickens the mucus for penetration of the sperm to get all the way up to that egg. At the ampulla region of what we call the fallopian tube is where conception 80% of the time occurs. Phytoestrogens are dietary estrogens. These are the better estrogens. The phytoestrogens present in such foods like linseed, flaxseed, soy products, and legumes and yams. Also found in sweet potatoes, sesame seed, licorice root, soy products, tofu, tempeh, miso, and edamame. Now, it's important to know when I say soy products, I'm talking about fermented soy. I'm not talking about non-fermented. I'm not talking about soy milk, soy cheese, soy yogurt at the grocery store. I'm talking about the fermented ones that I just mentioned. Those are the one. If you talk to Asian women, they barely have hot flashes over there in Japan, China, because of the soy. Let's look at it. Phytoestrogens play a protective role in our bodies, and in 2009 study in the Journal of American Medical Association confirms that among women, among women with breast cancer, soy food consumption was significantly associated with a decreased risk and reoccurrence. Another study found women who consume a high amount of soy foods consistently during adolescence and adulthood had a substantially reduced risk of breast cancer. Again, I remind you, that's the fermented soy. What are xenoestrogens? Well, xenoestrogens are foreign estrogens that are industrial-made compounds. Evidence suggests that xenoestrogens are harmful to the human health. Found in foods, drugs, cosmetics, insecticides, herbicides, plastics, oils, paints, and adhesives. Here's some of the places we find these. Commercially raised animal products, plastic and canned goods, personal care products, makeup, lotions, perfume, suntan lotion, oral contraceptions, pharmaceutical medications, food additives, preservatives, styrofoam products, laundry and dishwashing detergent, household cleaner, air fresheners, pesticides, and herbicides. Avoiding these xenoestrogens. How do we do that? Read the labels. Be aware of what you are buying. Paraben-free is a good thing to look for. BPA-free is a good thing to look for. Recycling numbers 1 and 2 in addition to looking for glass and stainless steel alternatives to plastics. Never heat styrofoam or plastic in the microwave. You're going to leach more estrogen into that food. When I see ingredients with a list that looks like a paragraph, don't put it in a basket. There's too much in it. We use certain nutrients to block this, which we'll get into later, like indole-3 carbinol and DIM. Women suffer needlessly from confusion about hormones. Women are completely confused about hormones in this world because nobody seems to know what's going on. They all are trying to put all the hormones in one basket when they talk about estrogen. Many women are so confused and frightened about hormone replacements, they have decided to forget about it. Remember, hormones are not just for the cycle, not just for having offspring. You have to have the hormones to keep your fountain of youth, which we'll talk about more as we go. Women who were recently told they could regain their lost sexuality by using hormones, and now by being warned against it. All this confusion is a shame. As a result of it, women are losing out on feeling their best and getting the most from their lives. To understand hormone replacement requires the patient to look beyond the name. This is because the hormone product are produced naturally in the body, the hormone by the drug company or made by the drug company, pharmaceutical companies, and the bioidentical hormones offered by physicians who specialize in anti-aging medicine are all referred to simply as hormones. They're not the same. If you have pharmaceutical hormones or synthetic hormones, they're completely different than bioidentical. Bioidentical fit together like a lock and key mechanism in the body. They work naturally, they can be broken down naturally, they can be exhausted off the body if not needed. When it's synthetic, what the hormone does is it forces the body to do something that it either needs to do or may not want to do. And that's the scare. When it does something it doesn't need to do, that's where the trouble is. It'll force it. That's the difference. To further confuse matter, all hormone replacement therapy, whether it involves hormone, drugs, products, or bioidentical hormones, is referred to as HRT in most publications. They're not all the same, like I said. With the exception of conjugated estrogen, hormone drug products are not naturally occurring in nature. As a result, the body's immune system mounts an attack to them. The action compromises the immune system's ability to do its job, which was meant to do, and may be one reason cancer is associated with hormone replacement drugs. The most often prescribed form of estrogen hormone drug, Premarin, is advertised as a natural product, and technically it is. It's derived from naturally occurring horse urine. But it does not have the same molecular structure as the estrogen naturally made by the human female. There are side effects associated with its use to include endometrial cancer, stroke, and deep vein thrombosis. Progestin are not progesterone. No matter what the pharmaceutical brochure says, they are synthetic replicas of progesterone with low compatibility in the human body. They're not the same. Bioidentical is identical to the hormones in the body. Synthetic is not. The conjugated estrogen plus progesterone, which are the synthetics, cause myocardial infarction, stroke, invasive breast cancer, pulmonary emboli, deep vein thrombosis, dementia from the combination. When conjugated estrogen is prescribed with progestin, the health benefits that result from the natural rhythm of the body is lost. There's a natural rhythm of how the hormones work in the body. Remember that, because later on I'm going to talk to you about how you have to play that rhythm in the body to get the hormone balance correct. Following the one-size-fits-all approach of hormone drug therapy, methyltestosterone is included in the same pill as conjugated estrogen. There is no way to adjust the dose to match it to be individual needs to a woman. You can't put it all in one. You have to put it where it's needed in that rhythm, which I'll explain later. Acne, high blood pressure, excessive and coarse facial hair, body hair, deepening voice, polycystic ovarian, weight gain, and unstable blood sugars can occur from this. Natural hormone therapy, which should be designated as NHRT, is how it should be written. Do not have the exact same molecular structure as the hormones made by the body, the synthetics. Phytoestrogens are hormones naturally found in plants and fall into this category. Now, when I talk about the phytoestrogens, there's the phytoestrogens that block the receptors of estrogen, and then there's other phytoestrogens which are heavier that don't. Remember, that's the non-fermented ones. Take back. Technology and the advancement of modern medicine has never been greater. Nevertheless, people are getting fatter and sicker than ever before, with growing rates of diabetes, obesity, cancer, sterility among men, women, and children. Xenoestrogens mimic the effects of true estrogen and interact with cellular receptor sites. This process contributes to estrogen excess and blocks the effects of true estrogen. To make matters worse, the endocrine disruptor lodge in fat cells where they are resistant to breakdown. They can't break down naturally. They're not bioidentical. Remember, the bioidenticals lock and key. They can be broken down and exhausted off the body if not needed. Get off oral contraceptions. Anybody that comes to DHS knows when I talk hormones, I'm begging people to get their kids off the oral contraceptions. Take them out of their lives. You're disrupting their hormones completely. Stabilize your blood sugar, detox the body, maximize your nervous system. High intensity exercise opens up detox pathways through sweating enhances cellular oxygenation, stabilizes blood sugar, and promotes reparative hormones, amongst other things. Don't forget to exercise. So endocrine disruptors. Endocrine disruptors are things like plastic bottle and containers, liners of metal food cans, detergents, flame retardants, food, toys, cosmetics, and pesticides. So let's take a look at those. What are they? Bisphenol A, BPA, dioxins, perchlorate, perfluoroalkyl, salicylates, phytoestrogen. Now remember, this phytoestrogen means the ones that are non-fermented. The fermented ones like tofu and edamame and miso soy are good. Polybrominated diethyl esters, polychlorinated bipheноls, and triclosan. Triclosan is what we find in our liquid body soaps and our hand sanitizers. Where are they commonly found? Baby care products, eye care, skin care, lip products, lipstick, lip gloss, lip balm, lip liners, hygiene products, deodorants and antiperspirants, hair care, mouth products, shaving options, tanning, UV, which is your sunscreen, suntan lotion, hair removal, skin lightening, feminine hygiene products. Where did it all begin? This work began with studies on the endocrine disrupting effects of a drug called diethylstilbestrol, DES, from 1940 through 1970. DES was used to treat women with high-risk pregnancies with the mistaken belief that it would prevent miscarriages. In 1972, prenatal exposure to DES was linked to the development of a rare form of vaginal cancer in daughters whose mother took DES. Now, when we're talking preventing miscarriages, what do we want to talk? We want to talk stabilizing blood sugars, stabilizing the thyroid, and something that I discovered a long time ago that I shared with one of the chemists is octacosanol, a wheat germ extract. What octacosanol does is stabilize the glycogen in the uterus, stabilizes the hormones in the uterus, and maintains the pregnancy. We've had a lot of success in that protocol of using Biooctasol, which is octacosanol, with women that had problems if everything else was balanced and they were still having problems with miscarriages. That's the #1 thing that we should consider at that point. It's been a home run. They put it in the protocol manual. Okay, so the National Institute of Environmental Health found or discovered attention deficit hyperactivity disorders. Researchers reported in JAMA, Journal of American Medical Association, that ordinary exposure to certain phthalates, as found in urine samples, and that's the plastics, was associated with ADHS-related behaviors in adolescence. Reproduction, DES, which we just talked about, can cause an epigenetic change, altering the ways that genes are turned on and off in the reproductive organs of mice. The finding provided possible explanation of how endocrine disruptors affects fertility and reproduction. Bisphenol A, okay, a recent study found higher bisphenol A, BPA levels in women with polycystic ovarian syndrome compared to controls. Researchers found a statistically significant positive association between male sex hormones and BPA in these women, suggesting the potential role of BPA in ovarian dysfunction. PCOS is the most common endocrine disorder in women of reproductive age and is characterized by excessive secretion of androgens, which are masculinization promoting hormones. The syndrome raises the risk of obesity, type 2 diabetes, infertility, and heart disease. BPA is linked to thyroid hormone changes in pregnant women and newborns. The biphenol A has been linked to changes in the thyroid hormone levels in pregnant women and newborn boys. The research found that for each doubling of BPA levels was associated with 0.13 milligrams per deciliter of total thyroxine T4 in mothers during pregnancy, which suggests a hypothyroid effect. For newborn boys, each doubling of the BPA levels linked to a 9.9% decrease in the thyroid stimulating hormone, which means hyperthyroid for them. These type of changes will lead to cognitive and motor development problems in children. Common sunscreen chemicals that disrupt hormones. Studies show that 77% of cancers are preventable when one absorbs adequate amounts of vitamin D. Sunburns indicates imbalance. Now, sunscreens that have all the chemicals in them block the ability to make the vitamin D. The chemicals alone in some of these sunscreens can cause cancer. The problem here is when you burn or you have a sunburn, that's showing you there's an imbalance in the body. At DHS, I have a protocol that I use to help people tan. It's a defense mechanism in the body. So when you burn, that defense mechanism is not working correctly. When you slather on all that suntan lotion with chemicals, what you're doing is not only blocking the vitamin D, but you're penetrating some of these chemicals into the body, which can be risks for cancers. Common sunscreen chemicals disrupt hormones, can lead to endometriosis and low sperm count. Oxybenzone causes endometriosis and low sperm counts in males, penetrates the skin and acts like estrogen in the body. It's detected in most Americans' blood streams now. Actinizate alters the function of the reproductive system. Thyroid and even behavior in animals has changed. Homosalate can disrupt estrogen, androgen, and progesterone levels. Exposure to hormones disrupting chemicals can change the very nature of a man and a woman at the hormone level. Can change the very nature of a man and a woman at a hormone level. That's interesting. Maybe Caitlyn Jenner used too much of that suntan lotion. Vitamin D, very important in the body. We make it naturally when we're out in the sun. When we're naturally out in the sun for 10 to 15 minutes in the sun with none of the suntan lotions on, basically we'll make about 10,000 IUs of vitamin D naturally. That's the maximum you can make for that amount of time. Do it each day, you get 10,000 units each day. Here's our vitamin D that we like to use. BioD Emulsion. It's a great vitamin D, liquid form. It basically 5 drops is about 10,000 IUs, which is about the amount I use. Now vitamin D is very important. Why? Because vitamin D is part of something, if you remember about 10, 15 years ago, they talked about vitamin D in cancer. And vitamin D is part of what they make a D-binding protein with 3 sugars attached to it. Now, what happens when we get sick is you make T and B lymphocytes. Those T and B lymphocytes, what they do is they'll cleave off or cut off 2 of the sugars, leaving 1 sugar at the bottom. That molecule is called GCMAF. Now, that stimulates the immune system by stimulating the macrophage cell that helps to gobble up all the bad stuff in the body. Landmark UN study shows the deadly effects of human exposure to hormone-disrupting chemicals. Deemed the most comprehensive report on EDCs to date, highlights association between exposure to EDCs and resultant health problems, including the potential for such chemicals to lead to a non-descendant testicles in young males, breast cancer in women, developmental defects in the nervous system, prostate cancer in men, thyroid cancer, and attention deficit disorder and hyperactivity in kids. EDCs can enter the environment in a number of ways, through urban or industrial sources, agricultural runoff, or the burning and release of garbage and waste. Human exposure can occur through eating food, through inhalation of dust and drinking water, breathing in gases and airborne particles, and by skin contact. Remember these days, cookware, chemicals disrupt hormones. Do you remember the old Teflon days? I do. But here's what they found. Research from West Virginia University recently found that perfluorocarbons, an artificial chemical commonly used in nonstick cookware, can disrupt hormone balance and lead to early menopause in women. Now, if you go further down, you read, which are fluoride-containing chemicals can be found in all sorts of consumer products ranging from popcorn bags, pizza boxes, to Teflon cookware and dental floss. The chemical is linked to causing cancer, thyroid problems, liver and kidney damage, neurological disorders, and infertility. The best bet for cooking is to use only products that are inert and non-reactive. Highly quality ceramic, earthenware, enamel, glass, heavy gauge stainless steel, and cast iron cookware. With the cast iron, you have to be careful because cast iron will increase your iron levels. So if you have high iron levels or hemochromatosis, you got to be extremely careful with the cast irons. You will raise your iron levels with that. Now, back to the Teflon. We had one of those Teflon pans, remember? I think a lot of people did. My mom got her first one and, oh, look at the egg move around on the pan. It's fantastic, but as you scramble that egg, as you scrape that pan, moving things around in it, this is what it looks like. This is exactly what our egg pan looked like in my house. What I want to know is where all that Teflon right there went. That went in your eggs. Could potentially be causing cancer and also other harmful effects. I like the stainless steel. That's what I prefer. The high gauge stainless steel. Women exposed to common antibacterial chemicals more likely to break the bone. Women exposed to triclosan are more likely to develop osteoporosis. Where do we find that? Soaps, hand sanitizers, toothpaste, mouthwash. Look for that when you're out shopping. You see these kids running around all the time in the schools. They got that little hook on their hand sanitizers. They're slathering this stuff on all the time. You can get everything from infertility to what you're seeing, what I've already reported, and more. Here's the next slide. Hand sanitizer is no substitute for soap and water. Research shows that they do not significantly reduce overall amounts of bacteria on the hands, and in some cases they may even increase it. The typical hand sanitizer, which is usually alcohol-based, strips the skin of the outer layer of oil, which normally prevents resident bacteria from coming to the surface. You're better off to use soap and water. Wash 2 times over. John Harvey Kellogg talked about that in, I think it was 1934. Even if periods only happen for 1 week every month in a woman's life, that still amounts to 30 reproductive years that a woman uses panty liners, pads, and tampons. Now, women, are you aware of these toxins found in these common feminine products? I always try to tell the women to go more natural with any of the feminine hygiene products. Since the products are sold as medical devices, the companies that make them don't need to reveal everything about the ingredients. So, here's some of them in the female products. Dioxins, glyphosate, which is Roundup, mercury, phthalates, remember that's the plastics, the stuff in plastic. Here's one for you, rayon. Is a synthetic ingredient made from sawdust, and it's heavily linked to toxic shock syndrome. If you've ever seen somebody with toxic shock syndrome, it's not pretty. Basically what happens is their skin peels off like they got scalded skin syndrome or staph infection. Literally, you'll peel the skin right off of them. You have to be careful with these tampons. You have to get natural ones. If you get this in your system, you can run into that toxic shock syndrome, which is not easy to treat. Cancer risk because of the products. Women's risk of yeast infection and bacterial vaginosis is increased, and reproductive harm. The glyphosates, or what we know as Roundup, disrupts uterine development in female rats with just 7 days of exposure. 7 days of exposure. It's already disrupting the uterine. Negative effect female fertility, uterine cancer. That dose used on the rats was equivalent to what is currently permitted by the government and even deemed safe as a daily consumption. Breast cancer, brain cancer, and neurological conditions such as Alzheimer's disease, autism, ALS, multiple sclerosis, Parkinson's disease can all be caused by glyphosate exposure. Quit hosing down the weeds in your garden with the Roundup. Not good for you. Cancer-causing chemical found in hand sanitizer. Here's the hand sanitizer stuff. High levels of cancer-causing chemical known as benzene. Valisure also detected unacceptability high levels of methanol and acetaldehyde. Acetaldehyde is a class 2B carcinogen. Benzene is supposed to be removed from the final product before they seal it and pack it. So, exposure to benzene, what does it do? Drowsiness, skin irritation, dizziness, irregular heartbeat, headaches, tremors, confusion, unconsciousness, and death. The long-term adverse effects of benzene is anemia, leukemia. Women who have been exposed to the high levels of benzene, irregular menstrual periods, chronic exposure to benzene, low birth weights, bone marrow damage, and delayed bone formation. All right, let's move into hormones. So, need for thyroid hormone by the body. What do we see? These are the common ones that I underlined that we see. Fatigue, cold extremity or cold intolerance. These tend to be not the cold hands and feet people. These tend to be the people that feel cold all over. The ones standing over the heat register in the house saying, I'm freezing cold, I need a blanket, I need to be warmed up. Dry skin's a common one. Constipation's a common one. You can have any of these. Coronary artery is an important one to look at. Sore throats on a regular basis. Those people that are getting sore throats on a regular basis, that's another one. Diminished mental capacity is a huge one. Infertility, proper egg development and ovarian function regulated by the menstrual cycle. Basically, the thyroid controls that too. Anger before cycles, no one can stand to be around me, is what one patient said. That's a key one. People that have anger before cycles start looking at the thyroid. Born premature, mother had a weak thyroid. These premature kids, if you check the mother, you'll find a weak thyroid all the time. A past office girl of mine had her baby was premature born. I said, you have a thyroid problem. She wasn't sure of it. We checked it on blood, and sure enough, her TSH levels were off the charts. Seizure, responsible for proper development and maintenance of the nervous system. So these are all the things that can occur with a thyroid hormone need. So here's how the thyroid works. The pituitary in the brain sends down TSH, which is thyroid stimulating hormone, to the thyroid. The thyroid at that point makes T4. T4 now goes out into the peripheral body at the cellular level and is converted from T4 to T3, and then that has the effect on the body. T3 is the most active thyroid hormone in the body. Now, when people take levothyroxine or Synthroid or other synthetic medications for the thyroid, typically these two are dumping lots of T4 into the body. Now, if they have a conversion problem, which a lot of people do, if they can't convert that T4 to T3, and it's very hard to find that on blood work because it's at the cellular level, if they're not converting, what happens here is on blood work, they will look normal, their TSH will be down to normal, but they will tell you, doctor, my TSH may be normal, but I feel like crap. I still have the dry skin, I still have the hair falling out, I still have the constipation, I still have the swollen eyes and water retention in the face the next morning, and I'm fatigued. My moods are up and down. I can't get out of bed in the morning. So you may see a normal TSH from dumping in T4 with the negative reflex loop back to the pituitary, but you're not getting the T3. If you're not getting the T3, you don't have that active hormone in the body, you don't have it functioning at the cellular level, you still have all the symptoms, even though the blood work looks perfect. Now, what can block T4 to T3 conversion? Beta blockers, estrogen, lithium, shortness of breath and wheezing, birth control pills, iodinated contrast agents, phenotone, aging, alcohol, mercury, radiation, fluoride, pesticides, lead, hormone imbalance, alpha-lipoic acid, diabetes, stress, and surgery. Radiation is a big one. I had a patient years ago. He had leukemia. We treated him. He was treated by another doctor for 30 years, doing very good, both medical and alternative. He came in and said, now they want to radiate my thyroid as a precautionary measure, just precautionary measure. And I said to him, I said, don't do that. Radiation will reactivate the virus that causes leukemia in the first place. He said, Doc, it's U of M, I'm sure they know what they're doing, what have you. He had that radiation treatment. I said, if you get that radiation treatment, don't come in the office because you can't even hold a baby. It's such a strong radiation treatment. He had that radiation treatment, and 30 days later, we lost him. He was gone. His daughter, his mom still come to DHS as patients, and they say to me every third time they're in here, I wish we would have told them to listen to you. Now, inhibitors of thyroid function. Fluoride is a big inhibitor. We find that in water, city water, chloride and fluoride, city water, halogen metals, shut off the thyroid. Cauliflower, raw form is worse. Kale, walnuts, Brussels sprouts, radiation, there's that radiation again. Viral conditions with my daughter who was born without a thyroid. Anytime she's sick with a virus, we know right away her TSH spikes through the roof. Pregnancy, this is a big one. I tell all mothers out there, pregnant mothers, please check your thyroid every month. Have your thyroid tested each month. It's unbelievable how many pregnant mothers go into a hypothyroid state. So check it monthly. Tell the doctor, just please check it. You'll be surprised what you see. Cabbage, mustard greens, turnips. Soy will short circuit the thyroid if it's the non-fermented. Medications. Chemotherapy is another big one. We see all the time the cancer patients that have chemo. They'll come in and right away their TSH is off the charts, their T4 is down. That'll affect the thyroid too. Millet, puberty, and it didn't get on there, Lauren, but what else? Gluten. Gluten is another huge inhibitor of the thyroid. I have a sister-in-law that if she touches gluten, she can't function for a day. Shuts down her thyroid. Now, balancing thyroid and pituitary function. Now we get into some of the nitty-gritty of blood typing and what we use. This one here, I would never use it for a blood type A, B, or A. If you use it for a blood type A, Metastim, which is a converter of T4 to T3, what's going to happen is they're going to come in and say, I feel like I've been drinking coffee every day. I'm wired up. I don't like how I feel. I'm getting edgy. I'm getting angry. Take me off of it. This is a home run for your blood type Bs, your blood type Os. Complete home run. Now, Iodoro is one of my favorite iodines that I use. Liquid iodine, if it tests, we'll use that. A lot of times I use it with upper respiratory infections too. Thyrodstim, I use it to push the thyroid. We have a pituitary condition and a thyroid condition going on. And usually we'll see that at times. GTA is an absolute home run for the high TSH people where you want to bring down the TSH and stabilize the TSH. I use this one for the T4. If I'm looking to bring up the T4 on blood work, I'll use Iodoro or sometimes liquid iodine. Now, Cytozyme PT, HBT, if you have somebody that has a low TSH, and there's a couple reasons why TSH goes low. It can be a hypopituitary, but many times if you have that super low TSH, 0.01, 0.02, but you have a normal to low T4, you have a person that has a potential heavy metal problem. You don't have a person that has a hypopituitary. In other cases where you see the TSH at like 1.2, 1.0, if the symptoms follow that they're feeling fine, no condition, leave it alone. Some people function at 1, at a TSH of 1 better than 1.8 or 2.1. But you have to use the symptoms too. So if you have somebody that has a TSH that's real low and they're thirsty all the time, can't quench their thirst, they have low libido, they have band-like headaches, and they're moody up and down like a roller coaster, then you're going to want to go to the PT, HBT and put them on it about 4 a day. Now I will tell you the blood type O's do absolutely fantastic with the pituitary, because you have to remember something. If somebody's on thyroid medication, there's a negative reflex loop that goes back to the pituitary and shuts it down. So naturally what happens is they become moody on thyroid meds, they become thirsty, and they can get headaches. It's a good idea to put in about 2 or 3 of these if they're on levothyroxine or Synthroid to balance out their pituitary. Other thing is, one of the biggest things with this here is the type O people, whether on medication or not, the super cold hands and feet. They get in bed, they touch your side, and you jump out because they're like an ice cube. This is a home run to warm up their hands in about 3 to 5 days. Those are home run therapies. The adrenal gland. It sits on the posterior medial side of the kidney. What it does is it's our stress gland. If you ever remember the old backup lighting system for when the power went out, those boxes with the 2 lights on them in the building, when the power would go out, they would kick on, and they were a safety mechanism so you could get out of the building. That's your adrenal gland. When you're under fear, anticipation, anxiety, physical or emotional stress, your adrenal gland secretes 38 different hormones in a matter of a second or a minute to get you out of that stressful situation. If it occurs for a long period of time, you short circuit the adrenal gland, and now you start to get the symptomatology of the adrenal gland, which we'll see here in a minute. Main symptoms: 1 to 4 p.m. fatigue. By 4 o'clock, you're sitting there feeling like, I'd like to quit my job. I'm so tired. I'd like to go home. Why is 6 o'clock not here yet? Crave salts, yawn all day long. The guy that's doing this at 12 noon, because he's still yawning. Now that can be sleep, but not most of the time. It's adrenal fatigue. Slow recovery to illness, that's a huge one. Can't hold an adjustment. The people that come in, not of the neck, because if they can't hold in the neck adjustment or they're constantly in pain there, you got to check the thyroid. The mid-back, if they're constantly like, I want an adjustment, I want an adjustment, I want an adjustment, you need to check the adrenals. Feeling overwhelmed, autoimmune conditions, wired and tired. That's another one. The person that's tired during the day at their job and then goes home at night and 5 o'clock, then they want to stay up to 2 in the morning. That's what I call wired and tired. That's an adrenal problem, and I like to play that two different ways, which I'll explain even more. But I like to stimulate the adrenal in the morning, and I like to take it down at night with the ADHS, which I'll explain later. Hypoglycemia, inability to lose weight, low blood pressure, asthma is a huge one. Let's not forget the adrenaline relaxes the smooth muscle around the trachea to prevent that asthmatic attack. That comes from the adrenal gland, and brain fog. Now, here's some of the visual stuff you'll see. The whites of the eyes will appear to be blue or gray in color. Now, if they're solid blue, you got to remember there's another condition that comes with that. But if they have that tired look and constantly fatigue, and oh, by the way, that condition is osteogenesis imperfecta if their eye is super blue, the sclera. But a tired or constantly fatigued look on the face, dark circles that extend above or below the eyelids, and vascular convulsions in the corner of the eye. Look for adrenal fatigue in those conditions. Need for adrenal hormone. If you're a bodybuilder, I used to always tell the bodybuilders at Powerhouse, I said, listen, if you're fatigued out, do not go to the gym. You're breaking down proteins, you're not building them up. So muscle will not build if you're in adrenal fatigue. Estrogen need after menopause. DHEA, which comes from the adrenal gland, which is dehydroepiandrosterone. After menopause, a lot of times I'll use that to just boost up the estrogen if it's slightly low on blood work. Asthma, allergies, bacteria, viral infections, cancer, cardiovascular disease, Crohn's, and you can read all these of what we use the adrenal hormones for. Even increased prolactin. A lot of times I'll use B6 for that, but the adrenal fatigue will take that down too if you put in the right adrenal hormones. DHEA levels. They peak at about 20 to 30 years of life. In fact, most of the hormones in people start to decline after the age of 26. How fast they decline depends on what you do to your body and how healthy or how well you take care of your body. You have a hysterectomy, they're going to drop faster, which we'll talk about in a moment. Now, patients with low DHEA levels often suffer from chronic sicknesses, headaches with allergy season, asthma. The Baltimore longitudinal study found that men that have higher levels of DHEA-S have longevity to their life. With patients with autoimmune conditions, also check DHEA levels. Metastatic cancer patients typically have low DHEA levels. And increased DHEA levels also helps patients tolerate chemotherapy treatments with less adverse effects. So with the chemo patients, look for those levels of DHEAS. Now, here's the adrenal supports, and I'm going to play it by blood type like I always do. This one is good for every blood type. This is the one that stops the cortisol in the body. This is the one, when you have high cortisols, you affect sugars, and yes, you can gain weight because of that too. But this relaxes the adrenal glands. I like to use this on all blood types when they're wired up, usually in the evening. Sometimes I'll use it earlier during the day. So it works for all the blood types. This one here is an absolute home run for the blood type A's out there. When they have that afternoon fatigue, run down feeling, fall asleep in the recliner, everybody on Thanksgiving, even if they didn't eat turkey, want them to fall asleep in the recliner, this is the one for blood type A's, okay? This one here, DHEA, it's a home run for those women that have slightly low estrogen levels and poor libido. This is a home run for the blood type B's, the blood type A's, the blood type ABs that have libido trouble, right here. Now, the blood type O's, rhodiola ginseng is fantastic. Now, that seems strange. The blood type O gets super stressed out. They push past dopamine. They make catecholamines, norepinephrine, epinephrine. They're wired up. It takes O's a long time to get wired, but when they do, look out. It's a breakdown. This prevents the breakdown. When those blood type O's are super wired up, I would use the adrenal desiccated and the rhodiola ginseng. You'll put a smile on their face very quick. Now, Drenamine, this is a home run for your blood type ABs and Bs. I like this one. B6, B1, the people that tend to have that blubbery fat, a little heavier, too much estrogen, I'm going with this one also with one of the other ones. The simple adrenal I use on blood type Bs. It seems to work quite well for them. That's how you play those with your blood type or based on blood type. And the more I do with blood type, the more I believe that it's definitely what we should be doing. Need for progesterone hormone. This is a big one. Progesterone is huge. I use a lot of it. It's great for endometriosis. It's great for PMS, water retention. Here's a home run, the depression. I can't tell you, we had one in today. I can't tell you how many people are playing the Paxil or the Wellbutrin and this other stuff, poisoning an enzyme between the two receptors in the brain, because that's how medication works. Medication works one of two ways. It either poisons an enzyme or blocks a receptor. Now, with Paxil and Wellbutrin, they poison the enzyme in the brain between the synaptic gap, so it maintains the serotonin at the postsynaptic region, which hyperstimulates that postsynaptic neuron. We'd all be happy if we took that. The problem is, the longer you take that stuff, what happens is the serotonin wears out in the body, and now you actually become more depressed than you were before taking it. This one is missed a lot. A lot of females will come in and they have a crying spell, they have a bad period, and everybody throws them on the antidepressants, correct? What I see is look for the progesterone. When it's low, you put them on that progesterone, it'll snap them out of that depression, and you can't believe the difference they'll have. They don't need the Paxil, they need a hormone balance. Sometimes thyroid too. Now, osteoporosis is another home run. That football player that got the bug from the gas pump, you guys remember that one? His mom's a patient of mine, I can't say any names. She had this. Her MD said, you cannot get rid of osteoporosis. And he used to put little smiley faces with you, but not smiley, they were upside down frown smile on the blood work when it would come in as I began to treat her. Now, what I found out is most people miss this one. Progesterone is a huge one for osteoporosis. If you're not looking for progesterone deficiency with osteoporosis, you're missing the boat. The other one is thyroid. And people say, thyroid? What's thyroid have to do with bone? T5 hormone from the thyroid makes calcitonin. Last time I checked, that drives calcium into the bone. You have to look at the thyroid. You have to look at the progesterone if you're dealing with osteoporosis. There's not one peer-reviewed literature out there that will say calcium by itself gets rid of osteoporosis. So we played her hydrochloric acid, we fixed her progesterone deficiency, we tapped her thyroid, and guess what? The T and Z scores both soared on her bone scan. Fibrocystic breast is common when you're low on this. High blood sugars, you got to look for that one if you're struggling with your blood sugars. Mood swings, necessary for the survival of the fetus. Let's not forget something. The little ovary releases the egg, After it releases the egg, there's something called the corpus luteum that produces the progesterone. Small little dot on the ovary. If there's endometrium on the ovary, if there's a cyst on the ovary, that can get interrupted. If that gets interrupted, you're going to have something called a spontaneous abortion, miscarriage, right? So I like to play the progesterone with pregnancy because you're supposed to go up to 350 milligrams per deciliter each day while you're pregnant. So I play the progesterone, the bioidentical, very safe to do up to the 8th month to help maintain the pregnancy along with the octocosanol. Heavy flows with cycles, this is a home run. I find women with the heavy flows, clotted flows, this is a home run. There are progesterone receptors throughout the body, bone, heart, liver, brain, and other organs. Research has found that progesterone receptors in cells specifically designated for bone growth. Progesterone can counteract the excess estrogen stimulation that occurs in the body. That's a huge one. Don't forget that. Progesterone, bioidentical that we use, can counteract estrogen in the body. Remember, it's like a teeter-totter, these two hormones. You don't want it like this, you don't want it like this, you want it right in the middle. That's how you want the hormones to be. If they're off, if it's teeter-tottering either way, you're going to run into some trouble. So, here's the menstrual cycle. I call it the clock of the menstrual cycle. And the girls at the office here said, please, Dr. Gill, explain the first day of the cycle to people. Puberty, monarch, is when the cycle starts, okay? Day 1 is the first day that you spot or bleed. That's the first day of the cycle. Hormones are given in relation to the numbers and what part of the cycle you're in. And this is what I was talking about earlier. If we give hormones all at once, like I've seen many times, that's the wrong thing to do. They have to be in that rhythmical fashion for the body to work correctly, or else you got Jekyll and Hyde on your hands. Now, here's where the bleed is, 1 to 5 days, maybe 5.5, depending on the patient. Day 1 of the cycle's first day of bleed. This is called the follicular part of the cycle. Day 14 is typically 13 to 15 is where ovulation occurs. The LH stimulates and then releases the egg from the cycle, or from the ovary. The egg comes out. Typically, we see conception in this area here. This is called the post-ovulatory cycle. This is when progesterone is at its highest. Over here is when estrogen is at its highest. You got to learn how to know 21 day of the cycle is when progesterone is the highest. I think it's 7th day of the cycle is when estrogen is the highest. You have to know this cycle, or you have to know this wheel to be able to play hormones correctly in women. In all cases. Let's watch how we can play these hormones.
This is my patient, Alicia Johnson, and we were working with her, and in a short period of time, the results we got with nutrition with her have been fantastic. I asked her to share them with you so you can see what we can do for people in a short period of time with hormones. Alicia?
Yeah, so for months now I've been having issues with nausea, bloating, cramps during my periods, tired, fatigue all day long, so just overwhelming, like not feeling good at all, just throughout the whole day, just really pale skin, and just not feeling good after I ate meals. So with the supplements, I immediately started feeling way more energy lasting throughout the day. I wasn't hitting an afternoon slump anymore. So just all day energy was amazing. It has been amazing. My complexion has cleared up immensely. My periods have been painless. I haven't had any cramping, only lasting just a couple of days. So that's been so great. No energy slumps with that, no bloating, no more nausea, and just overall just feeling so much better and just so much more relaxed, and just feeling amazing.
For the ladies out there, can you imagine a cycle with no cramps, no bloating, no irritation? That's what we can do at DHS.
Now, Alicia, that's your surprise. You were in today. And when Alicia was in today, she had ran out of a lot of her stuff. Remember what I said early on, take your pills. She ran out of a lot of her stuff, and she said, I'm back because I ran out of my stuff and I'm not feeling good. We retested her. We put her back on what she needs. She's back on the successful program. She's going to feel great in a day or two. But that's why I always say, take your pills. And so she came in today and said, I'm out of a few and I'm feeling a little crummy. Let's get back to it. So that's for you, Alicia. Thank you for watching. Natrogest is my source of progesterone that I use. It's the bioidentical cream that we use. A quick story I'll tell you. I had a friend named Chrissy. It's rare that you get to go to school with somebody from preschool all the way up to my age now. All the way through school, we've known each other. She came in a few years back and said, I was telling her about progesterone cream. I always make the warning that, look, this will make you fertile myrtle, this stuff, so be careful. She said, Craig, we haven't been safe for years. I'm not going to get pregnant. It's not going to happen. 3 months later, Chris, you're out there watching. You were pregnant. You had your third child. That was fantastic. What a great kid. She took the nutrition for during her pregnancy, and the child came out perfect. Fantastic story. Here's the breast health stuff I like to use for the breast. Basically, Iodoro gets rid of the breast pain. Those people that have pain with during their cycle, breast pain. Simple Mammary gets rid of the lumps and bumps. This is a home run for taking estrogen down, which a lot of times will create the lumps and bumps. It'll create endometriosis. It'll create fibroids. This is a home run to get that estrogen out of the body, along with Cal-D-glucarate, Iodoro. These all work fantastic for that. I will test to determine which ones I use based on the patient and the condition. Need for natural estrogen. Natural estrogen is a compound, and it's in 3 types. This is how it is in the body. 80% estriol, 10% estrone, and 10% estradiol. It makes sense to give it in that type of fashion. So conventional estrogens, Premarin, estrates, do not contain the 3 forms of estrogen. This does not mimic the body's own production of estrogen. It would make more sense to mimic the body's production and release of estrogen according to normal patterns. When it is determined estrogen is needed on blood work, estrogen should never be given without progesterone. Remember that teeter-totter thing. You should never give estrogen without giving progesterone. The other thing is on blood work. I will tell you it's rare that I even give bioidentical estrogen unless I see it on blood work. I'll go to DHEA first to stimulate it a little bit, but I want to see it on blood work before I decide to give the bioidentical estrogens. Natural estrogen, menopause syndromes, improving skin tone. Boy, remember that lady, Jacqueline? She was low on estrogen. She came here as my patient, and I think it was everybody at the office here said, oh my goodness, Dr. Gill, that is one moody lady. And we found out her estrogen's low. If you've ever seen a female on low estrogen, 2 things happen. They get vaginal dryness and they get mean as a rattlesnake. And she was mean, her skin complexion was off. We put her on that bioidentical estrogen because she needed on blood work. What an amazing transformation. Her skin, texture, hair, everything changed, and she became a likable patient around DHS. Suppressing osteoporosis, memory loss, and mood swings, but it also causes things like fibroids, endometriosis, polycystic ovary, polycystic breasts, if you have too much estrogen in the system. Now, here's the ones I like to use. Remember the DHEA. If it's a slightly low estrogen, low libido, I'm using this. If I prove it on blood work, I'm using this over here that they need estrogen. This works fantastic. It's the 80-10-10 rule. That's how it's made. It's the only one that has that we have here. Balancing estrogen and progesterone. So if I'm going to do estrogen, I always do progesterone with it. If they don't have an estrogen need, I will do progesterone a lot of times by itself. That is the one I will do by itself. But if you're going to use this, you got to use them together. This one here, I would never use it for a blood type A, B, or A. I will use it for a blood type O all day long, twice on Tuesday. This is fantastic for getting rid of breakthrough bleeding after menopause, heavy flows with your cycle. The BioAE is what I tend to use with the blood type A. Sometimes I'll use it with the O's to calm down the heavy flows with the cycle, along with the progesterone cream, which is this one here. Now, I asked some women in the last couple weeks, I said, can you give me some things that you say about these hot flashes? What kind of things you say? And they said, well, I call myself Sweaty Betty when I get the hot flashes. One lady said, Dr. Gill, my hot flashes are so bad, I would make snow angels naked. That's how bad my hot flashes can be. One lady said, when my hot flashes act up and my cycles are off, it's like a crime scene in my pants. I think women can understand what that means. I've heard that several times over. And one lady said, it's like making Vicky soup. I sweat so much at night. So one of my home runs for hot flashes is right here. It's a secret that I have that works great. Gaminol Forte and B12. It's my go-to first before I even check the progesterone, the estrogen, the testosterone. This has been a home run for most people. It relieves the hot flashes in 3 to 5 days, and they like how they feel on it. Excess estrogen causes the vaginal bleeding or the heavy flows, the high blood pressure, nausea, vomiting, headaches, fluid retention, glucose imbalance. Remember, it also causes the fibroids, the lumps and bumps and things I said. Most women start off, their breast tissue is kind of like, I guess you would say soft like a pillow, and as they get older, it turns into like cottage cheese. That's when you know that you need to start looking for the hormone imbalance, the estrogen needs, the progesterone needs, the iodine needs, especially if they have breast tenderness. Remember, phytoestrogens, which are compounds found in food, protect the body by binding to estrogen receptors and allowing stronger estrogens not to bind to stimulate the receptor. So when you're using the phytoestrogens, that's the estrogens from foods, which are the fermented soys. Let's take that for example. What happens is they'll bind to those receptors, so the bigger estrogen, usually estradiol or estrone, can't bind. And remember what estrogen will do. It's pro-growth. So it wants to stimulate the body in a growing fashion, and if it's there too long, it's going to start something else. That's why we don't want it in there for a long time. Now, lowering estrogen. If I have somebody comes in and their estrogen's off the charts, this is how I'll lower it. The Endol-3 carbinol, you always have to play the liver because the liver conjugates your hormones. So you got to play the liver first. I'll typically use these 3 here, test them out. If they're overweight, heavy, and I think they have that estrogen binding into the fat cells, you need that B6 to cleave it. I love flaxseed. Joanna Budwig did that research study with breast cancer with sulfur and flaxseed, helping people get through breast cancer with this one here. I'll use that a lot too. It just depends. I'll test it. Cruciferous Complete, it's all the cruciferous vegetables, and that's a home run. It's got the 13C in the cruciferous vegetables, and that pushes estrogen off the body. Birth control. I don't know why anybody would put anybody on birth control. I remember the 80s, the early 80s when I was in high school. When the women went in, they cried for one day, they had some clotted flows or heavy flows, they all got this. This is a big disruptor. As you can see, inhibits normal cycle, affects the body's own hormone by decreasing them, inhibits thyroid function, inhibits DHEA, inhibits the function of testosterone. It's been found that birth control pills often create multiple hormone imbalances. I would not ever give it to my children, no matter what. If you have that daughter that's rolling around with cramps, can't go to school, heavy flows, miserable, crying spells, mean as a rattlesnake, diarrhea, back pain, any of that with their hormones, send them to DHS, me, Dr. Tent, Dr. Jeff. We will put this together and get them feeling better. Now, switching gears a little bit, I want to talk about something for the men out there, because one of these days I'm going to talk for you men. 5 gallons of milk a week is what Pete, my patient Pete, you know who you are, I'm not going to say your last name. Pete was drinking 5 gallons of milk a week. I said, Pete, your prostate's going to be as big as a pineapple in no time, and you're running the risk of prostate cancer. Why? Johns Hopkins Hospital did the research on this, and you'll never find a prostate cancer patient that doesn't claim to you when you ask that they were a dairy fanatic. Ice cream and cheese, number 1 and 2, milk number 3. Johns Hopkins did the research on it and proved that milk is one of the #1 causative factors of prostate cancer. 2.5 glasses of milk or 2 1/3 glasses of milk a day would increase your risk of prostate cancer by 34%. That's pretty high. Pete was drinking 5 gallons, still drinking 5 gallons of milk a week. And I said, Pete, eventually you're going to be in here talking to me about your prostate because it's going to be as big as a pineapple. Dairy's number 1. That's why you see no more milk mustache ads. There's class action lawsuits everywhere on the milk companies for saying that milk does the body good. John Hopkins did the research on that. You can look it up. Here's some of it. Dairy causes prostate cancer. This was in the meta-analysis of the American Journal of Clinical Nutrition. Men drinking more than 1 glass of milk per day had doubled their risk of fatal prostate cancer compared with men drinking less. Whole milk consumption also increases risk of prostate cancer reoccurrence in overweight and obese men, according to the 2018 study. Those who consume more than 4 servings of whole milk per week increase their risk of reoccurrence by 73%. That's high enough to stop, I think. Benefits of natural testosterone. Women too here. Improving osteoporosis, increasing well-being. Men jump on this one. Improving libido. Now let me tell you something. Here's an important thing that you need to know. I tell all men, before you jack yourself up on testosterone, please test your aromatizing pathway. See if you have it. If your estrogen is high in your body and your testosterone is low, you have an active aromatizing pathway. You keep pounding in that testosterone to be He-Man, what's going to happen is your prostate's going to blow. You're going to end up with prostate cancer. Check your aromatizing pathway. Check that before you start jumping on that testosterone, or you might find yourself in trouble. That's a huge one for men. Increase muscle mass, decrease anger. Men that have good testosterone levels shake hands and say hello to everybody. Decrease irritability, decrease nervousness, decrease tiredness. Prevent and treat coronary artery. That's a big one. Look for that in the men. Improve and treat autoimmune disease. Maintain and lowering blood sugars. Here's a big one. For those people that you're frustrated with their blood sugar and you can't lower it, start looking for the DHEA and the testosterone. You may find your answer to why their blood sugars aren't coming down. Testosterone is a major regulator of sugar, fat, and protein. Before dosing, always check for active aromatizing pathway, as I said. Columbia University College of Physicians and Surgeons found that with those with low concentration of testosterone in the blood were more likely to have atherosclerosis documented on angiography. All right. So here's what I like to do. Unlock your aromatizing pathway, both men and women. If you're converting testosterone to estrogen, this is what you want to use. Proteolytic enzyme Intenzyme. This was a big cancer one that a doctor that we knew who passed away used to use in his clinic. Chrisin, turmeric, apple cider vinegar, cruciferous complete, omega-3 EPA, DHA, and C complete, which is your vitamin C. Those all block the aromatizing pathway. I usually test for which one. The 2 I'm going to pick the most is probably going to be Intenzyme and the Chrisin. No, for no reason. I still test them all to determine which one is needed in the patient. Benefits of natural testosterone. Testosterone is a must for women that had hysterectomy, no matter if they have their ovaries or not. You have to check testosterone levels after a hysterectomy for the women. Testosterone levels help improve and treat autoimmune diseases such as lupus, rheumatoid arthritis. A study done among females with active lupus was found to have significantly lower testosterone levels. Check that DHEA. Play them both. Look for them both. Testosterone is also effective for complications of high blood sugar, including retinopathy, gangrene, and peripheral vascular disease, which is on the rise too. Here's the testosterones I like to use. This one will increase growth hormone in females by 45%. This one also helps with the hot flashes, as I told you. This will raise testosterone on blood work. I'm working on the other 2 to get reports on those, but they work fantastic. I've had great results with this with the females and even better results with this with the females that need it to testosterone. This one, for the men, I find it with sports. I did a little research on my own at Powerhouse Gym, and I put the Muscle Head Steroid Kings on this. I said, hey guys, I went to a group of them, and it's kind of risky to go to a group of steroid monkeys. And I said, listen, why don't you guys try this and let me know? I'm a local physician. I want you to take 4 of these before your workout. They said it was almost the same result with a 10% decrease, no anger, and I was happier on this rather than taking that cancer-causing steroid. This is a home run for the athletes. And it's not detectable, it's not anything illegal, but it works great at increasing muscle tone. This one, like I said, for the females, this one works great too. These are my testosterone go-tos in the office. So benefits of human growth hormone. The beneficial effects of using physiological doses of human growth hormone include improving and perhaps reversing many of the following signs of aging: thinning hair, wrinkled skin, loss of muscle tone, low resistance to stress and depression, low resistance to infection, poor healing of wounds, and varicose veins. On that Gaminol Forte, I had a group of flight attendants that was taking that Gaminol Forte, not because they all came in, because one came in, she started taking it, and the others accused her of using some new type of cosmetics or getting Botox. She was taking Gaminol Forte, it tightens up the muscle tone, her complexion looked better. So I'm telling you, that works. It will increase your growth hormone, but it will also tighten up the muscles. Human growth hormone has also been shown to improve the following conditions: cardiac disease, fatigue, osteoporosis, and perhaps cancer. Benefits of pregnenolone. The benefits of physiologic dose pregnenolone include treatment of the following condition: arthritis, depression, fatigue states, memory loss, and moodiness. Yeah, I was out on the golf course with my friend and his future wife, his fiance. She said to me, she said, do you sweat on the top of your head? I said, yes. She said, you know what I do? I give Botox injections. She said, I could put 100 injections in your head and you'll stop sweating on the top of your head. I said, no thanks, you can keep your Botox. So don't get the Botox injections on the top of your head. I don't want my face to be swollen the next day or looking like I had a stroke. Repairing your cervix. This is a big one. Repairing your cervix. This is a big one. 80% of all STDs come from college campuses. That's where 80% of them are at. Human papillomavirus, herpes, gonorrhea, syphilis, whatever. You have to protect the cervix in today's world. This is how you protect the cervix in today's world. Turmeric has been found to reverse HPV. Do the research, go look it up, it's out there. Folate 5 Plus is the methylated form of B12 and folic acid. You have to put this one in. These two are a home run together. I like to use this one in a douche fashion. Now that can be a headache. I don't like talking about that one. But the way I do it is I tell them, take the tampon, stick it in the liquid iodine, insert it up there 3 times a week for 3 weeks for an hour, elevate the butt. This works wonderful, wonderful for helping that cervix. Trust me on that. Dysmusine granules is another home run. It's your SOD, superoxide dismutase, and that is the way I would protect cervix and anybody that had any kind of virus that was attacking that cervix. Now, don't worry guys, I have something for you too. For the men out there, the Japanese study of FEX and citrus pectin for that stubborn PSA that won't come down, this is a home run in Japan. Now, I love the Prostapower. That works great for men. Waking up at night, peeing a lot at night, this is a home run. This is another one I use, and I probably should have put it on the cervix one, grapefruit seed extract. There's a lot of things that go through that prostate in a year's time, and I would put that in with it. I found this to do wonders for different STDs as well as prostate problems and cervix problems in the female. Back to growth hormone. Thinning hair, wrinkled skin, loss of muscle tone, low resistance to stress, depression, improved mineral density, low resistance to infection, poor wound healing, increased body fat, improved workouts with strength and stamina, increased skin thickness. This is important to know. It's been found that people with cancer have low growth hormone levels. Therefore, when looking for cancer prevention therapies, it is a good idea to evaluate growth hormone levels. It has been found in liver cancer, endometrial, uterine cancer, and colon cancer. One study on cancer patients showed growth hormone supplementation reversed body wasting and promoted the growth of lean tissue. There are no studies to indicate small physiological doses of human growth hormone promote cancer growth. Common sense would prohibit giving any human growth hormone if levels are found above physiological range. The combination of amino acids, arginine, lysine, glutamine, glycine, tryptophan, ornithine, and tyrosine will improve growth hormone levels. Gamanol forte can raise, like I said earlier, hormone levels by 50% in some patients. It has been found that 8 out of 10 women given Gamanol forte had growth hormone level rise by an average of 45%. So that Gamanol works well. Remember about hormones. Remember what I said, about 26 years of age, they start to decline. How you take care of yourself or what surgeries you have can make them decline faster. Here's your growth hormone. 10, 20, 30 years of age, look at how it just drops out. Those older people that have that baggy skin that looks like paper mache, looks like if you just touch it, it's going to tear. I'm going to use things like sesame seed, Gamanol forte, chlorophyll to thicken up that skin so it's not like paper mache. Growth hormone can be measured in blood as IGF-1 tests. The range is 250 to 300 nanograms per milliliter. There has been concerns that growth hormone may stimulate some cancers by stimulating leukemia and lymphoma cells in culture. However, there are other studies show that growth hormone does not increase cancer risk and improves the function of the immune system. Therefore, it is prudent for cancer patients to discuss this with their physician and have the corresponding blood tests to see if they need it. That concludes my hormone seminar, but I want to say this. This is a friendly reminder. We are currently experiencing stock issues and delivery delays like most people in the United States are. Most time there are alternatives to a current product you are looking for. Please don't hesitate to call and ask an assistant for help. However, if there is no replacement, we kindly request your patience. We are doing everything possible to make sure Diverse Health family members has everything available as soon as it hits the building. We're running into problems because of the COVID with bottles and everything else, getting the stuff we need to get the product here. So we have a little bit of interruption here and there. Please bear with us. We're going to do everything we can to get that product to you as soon and as fast as we can. Thank you for shopping local. I want to do a shout out to Moe's on 10 in Novi. They're a great restaurant. They feed us well. They take care of us. They get us right in and out at lunchtime so we can get back to our patients and make sure we're getting them healthy. DSH has always been about supporting local. The products we carry, the companies we work with, Food Research, Biotics, Standard Process, MediHerbs, and yes, Zorax, Harry. We use all of them. Thank you for listening. Thank you for checking in. If you have that daughter, that daughter-in-law, that mom, that aunt, that uncle, the grandmother that have hormone problems, please send them our direction and watch what we can do with natural things. And one and last final thing, don't forget to take your pills and say your prayers. Amen and good night.